Hot Mess Mom 68 here. I'm coming to you after a little while of not making a video. I wanted to give you an update. I went to Bellevue yesterday with my husband to see an orthopedic surgeon on my hand. I have to say, I really like him. His name is Dr. Lyons, and my story is a long one with this hand. It is a very long story. I've seen 6 different doctors, and he was my 7th one. I have gone through a lot. This has been 3 years of being in pain. 3 years of doctors telling me that they don't know what's wrong with me or how to help me. And I show up and give him basically a rundown of what's going on with me. And I broke it down for him because, it was a long story. I wasn't going to tell him the whole story. It just wasn't going to happen. It's a long story, so I broke it down for him. And just in that little bit, he's like, okay, let's examine you. And he examined me. He looked at my hand, both my hands, and he messed with it. Of course, that hurt, but, I dealt with it. And he believed, he's like, okay, this is what I know is wrong with you. What I believe is wrong with you. You have 2 problems going on, both not related to each other at all. He said that, 1, I have a compressed ulnar nerve in my elbow. That's the first issue. Second issue is there is a bone, a small little round bone in the palm of your hand right there. It's called trapeziform bone. That bone is what's causing all of my pain in my hand. The not being able to put pressure on my hand, not being able to grip anything, not being able to spread my fingers, not being able to do anything. That is all of my pain. Now, the reason he knows it's all of my pain is because I sat through an injection of lidocaine yesterday where he took a needle and put it in the side of my hand right there into the pisiform joint. Painful. Very painful. I cried a lot. It hurt a lot. Very painful. But the lidocaine numbed my joint and my pisiform bone area, and within minutes I had no more pain. None. He could move my hand. He could touch my bone in that area. I could put nothing. No pain. I was good to go. I was on cloud 9. I wished it would have stayed, but the lidocaine only lasted an hour. However, it worked, which means it was my pisiform, that was causing all of my issues. Sorry, I had a little fly flying around my face. My pisiform, which is causing all of my pain in my hand. So, long story short, I'm going to have surgery. And what he's going to do is he is going to go in and he is going to orthoscopic surgery. He is going to decompress my ulnar nerve in my elbow. Then go in and remove my pisiform bone and decompress my ulnar nerve in my wrist. All of that said and done, it's about a 4-week recovery and then another 4-week therapy. So he says it's going to be a while before I can use my arm, a while before I can lift anything with it. It's going to take a lot of recovery time and a lot of therapy to bring my arm and hand back to where it needs to be. However, it would be a whole lot easier than fusing the bone. So there's 2 ways he could fix it. He could fuse my pisiform to where it doesn't move, it doesn't jiggle, nothing, and it would cause my pain to go away as well. However, that is a 6 to 8 month recovery. Long recovery. And he has seen better progress in the removal of the bone. Now, removing the bone isn't a big deal. It's not an issue. It's not going to do anything to my hand. It's not going to cause my hand to be different in any way. It's not going to harm me. It's going to make me better. So I opted to have it removed. I will receive a phone call within 1 to 2 days to make an appointment. And then I will go to Seattle and I will have my surgery done. This has been a long journey for me. I'm very relieved and very grateful that I finally found a doctor that is willing to help me, that has seen what is wrong with me and knows what needs to be done to fix it. I'm very, very thankful for that. It's been a long time coming. Now, I did ask him, I said, with this being said, and you remove the pesiform and you decompress my nerve, will I be able to go back to massage therapy? That was my dream. Massage therapy was my love. It was one of those jobs that you love to go to. I loved being a massage therapist, and I haven't been able to do it for 3 years. And he looked at me and he goes, if all goes well, I don't see any reason why you cannot go back to work. Do you know what that does to me? Do you know where it puts my heart? Like I'm in heaven, because I have a true possibility of being able to go back to work, back to giving massages. I'm in heaven. Like, I cried. The doctor made me cry. Like, I cried in the office, and then I think I cried the first 15 minutes on our journey home that day, because I was so relieved and so happy that I was going to possibly be able to go back to the job I love to do. Something that makes me so happy. I'm just so thankful. So that is where we stand. I'm getting it fixed. I'm so happy. I'm getting it fixed. I'm on cloud 20. No cloud 9. I'm on cloud 20 because I'm just ecstatic. I'm finally getting it fixed. After every other doctor telling me, we don't know what's wrong with you. I'm finally getting it fixed. I'm so grateful and so thankful, and I feel so blessed. I'm in high heaven. So I wanted to video and give you that update and let everybody know where I stand. I'm so grateful for my viewers. I'm so grateful for my subscribers, and keep watching, and if you like, please subscribe, and thank you again for watching, and I will see you later. Bye.